I hope you're all doing well. I want to talk about a couple of things today. Those of you who've seen the pretty sad CDC news about their complete screw up on tracking of the vaccines, I guess don't be surprised. It's CDC, they're underfunded. It's not surprising that they were tasked to monitor all the side effects and they didn't. And now they're heavily apologizing to the public. They started monitoring in the spring of 2022, 12 months after they were supposed to. Their director basically saying, oops, sorry, we don't have an excuse to you and we will do better. The good news is that since the beginning of monitoring, nothing new has been discovered. So that is a good news. So they haven't they've run a more detailed analysis that didn't really reveal anything new. The part of the grief goes back to the VA, because the VA, Veterans Affairs System, they started, and Veterans Affairs and an Army and the Navy, all three, they were basically saying, look, we're seeing a lot more than you told us, cardiac inflammatory response after the vaccines in the young soldiers. What's up with that, and where is your data on this? And so now there's a little bit of a political conundrum, because CDC is saying we're not telling you anything new, but the VA is saying bullshit because our data is very different from yours. So I will keep tracking this because I find it a little interesting from political perspective, sort of how this whole thing evolved. But that leads me to one particular point. Unfortunately, I'm afraid that we will never have a full disclosures on all the toxicities and all the side effects from the vaccine. I feel like there's always going to be we're going to be a little bit behind. So how I see this, and because as I said last time, they're not going to catch up with the ongoing variants. So BA4 and 5, the vaccines are likely only going to cover 1 and 2. So I'm expecting that with that, the logic of frequency of vaccinations with boosters probably going to be time-based, and maybe I'm going to track the Europe. It sounds like in Europe, there is a desire to consider tracking the titers. I haven't quite followed that enough to give you my position on this, but I have a feeling that I will position myself in the middle, saying probably we should be aiming at the annual boosters, but not twice a year. That'll probably be my take on the situation. Stay tuned on that. And with that, I think, I don't have any monkeypox update, by the way. If anybody is interested, there are a very rapid increase in resources. I talked a little bit about this last time, but if you have questions, throw them in too. So let's see if I can handle monkeypox questions as well, if there's any. So you know the drill, put questions in the chat box and we'll go, or if you have to speak up, just unmute yourself and speak up. Yeah, Benito, I don't know what to tell you. It seems like there is one problem after another that they never seem to be able to get their act together to get the public opinion trustworthy on what they're doing. The good news is that since that large intake of data and processing, we're not seeing anything new and concerning. So I'd say that's good. So all the issues that are coming up, they're old issues. So the myocarditis, which is inflammation of the heart muscle, that was found in this, in a rare but significant number of cases, mostly in young patients in young crowd, is there, but the data doesn't show that there's an increase in the incidence of it. So it's pretty low incidence. Yeah, I don't think anybody gathering, Jennifer, any data on the immunity after getting one of the variants. I think, how would you do that, I guess would be the question, because you can only see how you respond to an existing variant. And so when variants change, if you had one reaction to one variant, we don't know what that means to the next variant. I think that's the best I can answer that good question. I am not the good news also for the moment that we're not seeing any new variants. So maybe we're going to see a slowing down of new variants. It's now been close to 3 months, I say, since 4 and 5 showed up. So, but it's also a summer, and last 2 years, the summers have been a little slower to begin with, just because we're outdoors, transition is slightly lower. What will happen in the fall? Unfortunately, based on the last 2 years, we should say something not good is going to happen in the fall. I'm laughing because I'm not, it's a Russian joke. You always expect that it's going to be better, and it's always the same, meaning it's always worse. I don't know. We'll see. The good news is that most of us by now have some immunity. And so I think the hospital census is not changing. Very few patients with a severe illness. Paxlovid is definitely became partial game changer. Again, my opinion on that, since nobody's asking questions, I'll keep talking for a couple more minutes.
I actually have a question then.
Go.
Okay, here's my question. So are they even tracking what's going on with Paxlovid?
Yeah, they are. Mm-hmm.
Yeah, I don't really trust anything anymore. I thought you were going to talk about.
You have a full right not to trust. No, it's not just
CDC loosening the guidelines. I didn't hear about this at all. I'm shocked.
Don't get me wrong. CDC is not the only agency. The CDC is supposed to be the most trustworthy agency collecting the data, but they're not the only agency, right? There's a lot of large institutions doing trial. There's a lot of other monitoring of data occurring. So it's not all. It's just you would want the CDC to be the final authority here because they're supposed to be. I mean, we're supposed to primarily listen to the CDC recommendations. What can I tell you? But, you know, the good news is with Paxlovid, in practice, yes, the chance of delayed hyperreaction or non-reaction is about 5 to 10%. But that's a pretty low percent, and those patients don't get worse. They simply have a disease lasting longer. So they may need a second course of Paxlovid. The only thing with Paxlovid that I will tell is just the nuisance for people on multiple medications, because you have to be very, very careful. If you're taking no drugs, nothing to worry about. If you're taking drugs that have no liver interactions, nothing to worry about. If you're taking drugs that you need to be worried about, then you really need to carefully weigh pros and cons. I have not had any single patients having problems since I'm on the Paxlovid. What I do is, if you're traveling in US, don't stock up, because you're going to get it anywhere. Hopefully you can reach somebody to get your prescription right away, or go to urgent care wherever you go. If you're traveling outside, if you're my patient, let me know. I will send the order, because that's the situation where I don't want you to wander around figuring out what your situation is with the local government to try to get Paxlovid outside of the US. So, and because it's a small pack, it's easy to travel with, and there's no shortages. So, more long COVID now or less? Great question. I don't think anything changed. We're seeing a rapid total uptick in patients. One little bit of news, we're starting the long COVID groups on September 8th, will be the first day of group. Ashley will be our, those of you who can say French, please say her last name. I'm still not there. Drapeau, is that okay? Or is it butchered as always? Okay, so Ashley is gonna be leading it, and I'll be helping her with that. And then we're going to have a couple other people helping with the process. But the total number of COVID long-term patients is increasing, for sure. There's no question about it. But the speed of increase, I have a feeling it's slowing down. But again, I don't know. I can't. I'm not tracking enough data to tell you for sure. I'm telling you this as partially my experience, what we're seeing in the clinic, but also from what I'm seeing in the literature. It doesn't mean it's accurate. All right. Well, I guess unless there's a last question. Oh, Judy posted something. Sorry, I didn't see it. saying that they still don't feel that. Correct. That's what everybody's saying. That's what I'm trying to tell everybody, that even though the formal risk is 10 to 20%, but I would say upwards of half of everybody gonna have some symptoms months out. They may be mild, there could be some mild fatigue or brain fog, but it's there. That's why I'm so aggressive when COVID hits with everybody, that everybody gets a pretty aggressive supplemental package. Those of you also who've interested, there's this whole new thing of intermittent fasting during COVID and hyperbaric oxygen. Hyperbaric oxygen is hard to get, so it's not going to become standard anytime soon because of the complexity of the treatment. But intermittent fasting seems to be relatively easy. I'll have to dig into the data as to what the actual regimen of that fasting is. I haven't seen that yet. But there's now at least 2 trials suggesting that it could do something. And a lot of rest and a lot of change in routine, because that seems to be critical. All right, I'll stop here. I think that's a good timing, and I'll pass to Meghan and Dr. Beier. Meghan, how do we say your last name?
Yeah, it's Beier.
Beier. Okay.
Oh, yeah,
I like to I'm doing well. I'm doing well with last names today. Since nobody commented, I must have said Ashley's last name correctly. That's good. Well, thank you so much for coming. Let's get you up on the main screen and take it away. Thank you so much.
Okay, great. I'm just going to share my screen quickly.
And I'm going to pin you. Okay, great.
Okay, can everyone see that?
Yeah, we just actually, Janet, I'm having a hard time pinning. Oh, there we go. We need to pin. Perfect. Thank you. All right.
Okay, great. So today I'm going to speak about integrating physical and mental health, and especially around the context of the unique needs of people who are living with chronic illness and disability. And this is going to be a very broad strokes overview, given that it's 15 minutes, but hopefully there'll be at least 1 or 2 take-homes for everyone who's listening. So I'm going to start by just very quickly giving some prevalence of chronic illness and disability, how common mental health diagnoses are in those populations, as well as how mental and physical health can interact. Again, very high level ways, and then also 2 strategies for managing the ups and downs of living with a chronic illness. 2 of my favorites. There's lots of other ones clearly that many mental health providers use when they're working with somebody whose primary concern is their medical condition, but I'm going to share 2 of my favorites. So just a little bit about who I am. I'm a clinical psychologist. I work at Johns Hopkins primarily with people that have multiple sclerosis. I have training in health psychology, neuropsychology, and rehabilitation psychology. I've been grant funded and published, and my primary goal with much of my research has been to increase access to care for people who live with chronic illness or disabilities. And one of the reasons one thing that I noticed with a lot of my patients is that if they worked with a mental health provider in the community, many of those mental health providers didn't really understand the medical condition and some of the mental health concerns that can go along with that, which sort of prompted me to start this little side project called Find Empathy, which provides continuing education for mental health providers and a free directory to help patients and families find medically informed therapists. So check that out if that seems interesting. So according to the CDC, about 26% of people in America live with some form of disability, and individuals who have a disability are 5 times more likely to experience significant emotional distress. That doesn't necessarily mean that everyone with a disability will experience a diagnosable mental health condition, but they may be more likely to experience moments of significant emotional distress. 6 in 10 adults live with some form of chronic illness, and about 4 in 10 live with more than one chronic illness. And depending on what type of chronic illness somebody lives with, up to 50% of individuals can experience a diagnosable mental health condition. So in my specialty, multiple sclerosis, about 50% will experience at least some form of depression in their lifetime, and a third will experience a diagnosable anxiety disorder in their lifetime. And so why are we seeing these kind of high numbers? There's kind of three main reasons. One is that there are times when emotions are directly impacted by the medical condition. So for example, if somebody has a moderate to severe traumatic brain injury, they can have difficulty regulating their emotions after that injury. So the emotional changes are a direct result of the injury to the brain. Likewise, in multiple sclerosis, my area, if somebody is having the autoimmune disorder is impacting the myelin in the brain, then it can have a direct impact on the brain, and so therefore can have an impact on emotion regulation. A secondary way that emotions can be impacted is by the medications or treatments that are associated with a medical condition. So for example, somebody might experience mania or hypomania after being prescribed or using steroids. Tertiary is kind of what we all sort of think about when we think about the connection between medical and mental health. But this isn't a given. And I often, as a health psychologist, tell people that they should really be working with their medical team to rule out primary and secondary first before we say this is kind of all in your brain, right? This is just about the emotional reaction to living with this. So the tertiary is emotional reaction to the changes that come along with living with a medical condition. An example would be a job loss due to certain kinds of symptoms. So there are kind of two skills that I really work with a lot of my patients around, especially initially. And that's identifying values and building on what somebody can do. And then the second comes from dialectical behavior therapy, which is kind of living with two seemingly opposite truths, acknowledging both the grief that might come along with symptoms that you're dealing with every day, and committing to how you can change behavior so that you can live your best life. And so I think infused in both of these skills are mindfulness, which I know is something that your team speaks a lot about. So some of this might sound a little bit familiar. So identifying values. Values, I think, are really important because they can be lived out even if functioning changes over time. And an example of values are things like being courageous or engaging in fitness, humor, kindness, and curiosity. There's lots of other types of values. And at the link that's provided below, I'm happy to provide these slides. You can look at all of these different values, or you can just Google acceptance and commitment therapy, which is a type of psychotherapy, and values, and you can find many of these lists. So I typically do two types of exercises with the people that I work with. And so you can do these at home as well, whether you live with a medical condition or not. So I will look at one of these lists of values with the person that's in front of me. I'll ask them to rate how important something is. So for example, for one person, fitness might be very important, a 10 out of 10. It might be a 3 out of 10 for somebody else. Then we will rate how well somebody is doing in those areas. So if it's a 10 out of 10 fitness and the person rates themselves a 5, I might ask them what would need to be different to move up 1 point on the how well you're doing scale. And that might give you a little bit of an idea of how to incorporate that value more frequently in your everyday life. And so I think this is kind of a helpful way to figure out how do I bring these things in a easy, meaningful way that is small chunks. Another thing that I typically do is that I identify activities that has in the past brought joy, satisfaction, or contentment to somebody. Then we dive into the underlying core reason why that activity was particularly satisfying. And then we identify new ways to incorporate those core values into everyday life. So I'm going to give an example for that second exercise. So this is comes a little bit from an amalgamation of different patients. So this is not a real patient, but just sort of an example of different people that I've worked with. So Andy is a 57-year-old female diagnosed with MS. She was a lifelong runner. Besides enjoying that, it helped her to manage her anxiety. And as the disease progressed, she was no longer able to run and in fact, utilized an assistive device for walking. Other forms of exercise like yoga or weightlifting didn't bring the same form of enjoyment and satisfaction. So when we dove into that second activity, this individual might have identified reasons that running was so meaningful. For example, the opportunity to be in nature, maybe an opportunity to kind of have alone time away from kids and family, enjoyed the feeling of the sun and breeze on her face, enjoyed socializing with her running club. And so despite the ability not being able to run in the same way, we would examine alternative ways that she could incorporate those values that were underlying the joy of running. So an alternative sport like recumbent or hand cycling could get her out of the house in nature and with the sun and the breeze and socializing with others without the fear of falling. Or trying an adaptive sports program such as sailing or horseback riding. So you can see sort of trying to dig down into those underlying values can be really helpful for helping somebody stay flexible no matter kind of what life brings their way. The second technique that I like to use a lot is incorporating and. So this comes a little bit from dialectical behavior therapy. So for people who are living with a challenging medical condition, this could be something like long COVID. It could be living with diabetes. It could be something more serious. But there's often acknowledging the grief that comes along with that, right? So if somebody's living with long COVID and they have less energy to engage in the activities that they normally do, and so they feel like they're letting their family down, there's a lot of grief and frustration around that. So we want to acknowledge that part of it. We want to say that that is true, and there are opportunities for engaging in enjoyed activities or for behavior change that's going to continue helping that person to, if not get better, to live a meaningful and valuable life. So it's okay to grieve. It's okay to not want this disease, condition, or symptoms. And it's okay to acknowledge those feelings while trying to learn to live with the disease or problem solve the challenges and to try and find workarounds. So when I often find people who are not engaging in this, sometimes they feel like they have to get rid of the disease or condition before they can get back into their meaningful life. And that sort of trap keeps them from enjoying the moment right now or finding those little bursts of joy. If anybody else enjoys Brene Brown's work, you know, she talks about twinkle lights in the darkness. So I sometimes think about that. Well, this might be a really challenging thing to live with, but we want to acknowledge that it's really challenging, and we want to kind of hang on to and notice those little bursts of joy. They're both true. So the exercise is to try and help people flow and move in between these seemingly opposite ideas as needed. And I think a lot of times this incorporates this idea of mindfulness. So I had somebody recently who said that her husband was trying to help her transfer out of a car, and they had a little bit of a mishap and she ended up falling onto the sidewalk. And at first they were extremely embarrassed, upset, angry, all of those emotions that you could imagine. And then, so they kind of took 30 seconds to sort of engage in that frustration. And then they both took their deep breaths. They kind of joked around a little bit to try and change the mood. And then they problem solved, okay, how are we going to get off the ground and back into your mobility device, into the wheelchair? And so there's this idea to be able to acknowledge the feelings that exist, name them, acknowledge their presence, sit with them, and then without judgment, unhook from that grief or whatever emotion is coming up and look towards problem solving or enjoying the present moment. So another example of this, again, this is kind of a fake person, but an amalgamation of different patients that I've worked with in the past. John, a 67-year-old who intermittently experiences incontinence secondary to his illness. He experienced at least one episode of incontinence in public, which triggered a lot of anxiety, embarrassment, and uncertainty about the future and going on other outings. He acknowledged and named those feelings of anger, grief, anxiety, fear, and frustration. He journaled about it. He talked to close friends and family. He talked to me as a therapist. How do I work through this thing when it shows up? And then he turned towards identifying ways to address that challenge, scheduling an appointment with urology, spending a little extra time planning before outings, keeping an extra set of clothes in the car. That should say clothes, not close. And so that idea of if something bad happens, I can deal with it. So this is frustrating that I even have to make these plans. And I'm also going to continue engaging in outings because that's part of my valued living, getting back to that first exercise. It's kind of incorporating those values piece, mindfulness, as well as this idea of acknowledging two seemingly opposite truths at once. So I don't want to keep us. I know I only have about 2 minutes left. So I think the one thing I would say is that if people are struggling to manage symptoms or emotions are showing up and they're getting in the way of your everyday life, your relationships, your ability to do things outside the home, even your enjoyment of everyday life, therapy can be a really great option for working through those challenges. I often recommend working with a psychologist, a rehab psychologist, a health psychologist, a neuropsychologist, or a social worker or LPC that has experience with medical conditions, because they often can have a little bit more of a nuanced perspective on how to approach some of these challenges. And there's lots of different places to find therapists, although right now, in the world, it's very hard to find lots of therapists because of insurance challenges and breaking down stigma, which is great, but it also provides a challenge in finding somebody who takes your insurance and has a specialty. But I named a few places here, patient organizations, my website, as well as Psychology Today, National Register of Health Service Psychologies, the APA. And also, if people are not aware of it, there's something called PsyPact, and also licensed professional counselors are also having some new legislation that's going to allow them to work across state lines. So if there's not somebody with the experience that you're looking for in your home state, PsyPact and then this legislation for LPCs is going to allow you to find somebody in another state, so you can search more broadly for the expertise rather than just somebody who's in your immediate area if telehealth is an option for you. So that's it. And if anybody has any follow-up questions or would like to contact me, I'm more than happy to answer emails or talk further. So, thank you very much.
This is great. Thank you so much. And let's give maybe 1 or 2 minutes for 1 or 2 questions for Dr. Beier.
Sure.
Let's look through the chat.
Okay, yeah, let me look here.
And thanks, Janet. So we will include the resources in the email, so the presentation will be there.
Yeah, I'm happy to send a PDF.
Great. Well, I don't see any questions. But I have a question.
Sure.
I never get to ask questions, so that's good. We're going to see a lot of long COVID, and I think we're going to see a lot of things that are going to mimic certain things we've seen in the past. What's your general take on how this is going to play in a global scheme? Like, what particular challenges you think your profession is going to be seeing more, and how are you thinking are you going to be dealing with this long term?
So I think that I'm looking at it in kind of two ways. So the people that I specifically have seen, although I specialize in MS, right in the beginning of the pandemic, I was also seeing a lot of COVID patients. I think there's two factors. One is that we're seeing a lot of anxiety disorders that were showing up in the sense of fears like agoraphobia, not wanting to leave the home, fear of contracting the illness again. And sort of, so managing that side of it is a little bit different than, say, living with multiple sclerosis. So there's that kind of fear of infection that we're kind of managing. And then I think there's more traditional maybe rehab goals. So how do you manage fatigue? So a lot of the patients that we see with brain injury and multiple sclerosis and cancer have pretty extensive fatigue. So sort of pacing and management is definitely going to be true, or is true, of COVID. And I think also helping people to get back into functional goals. So functional meaning, how do we get back into doing an enjoyed activity outside the home or socializing without it completely depleting their energy levels, right? So how do you balance pacing with also enjoyed living? So those are sort of the goals that I'm seeing as I'm working with people who have long COVID.
Wonderful, wonderful. Let's say, make sure that people often talk about sitting with grief. I don't know how that works, because it seems that as though it asks what we call up and feeling on command.
So I would say that's like a little bit of a weird phrasing, and it's not super intuitive. To me, what it means is when that feeling shows up, you don't immediately push it away and avoid it. So if you were to push it away and avoid it, that means I'm feeling really anxious right now, so I'm going to turn on TikTok or YouTube or watch a funny movie and just pretend that feeling didn't show up, or to try and make myself feel better immediately. Sitting with the emotion might mean just acknowledging that it showed up and sort of asking myself, why am I feeling this way right now? So what brought this feeling up? It might be a 30-second acknowledgement of the emotion before you switch your mind, but it's not immediately pushing it away.
Great. I think there's one more question, and let's stop at Benita's question, because I think we need to move on to the mindfulness part. How do you accept living with an incurable and frankly untreatable and very unpredictable condition? That's a really good question.
Yeah, so I think accept
to answer in 30 seconds.
I think a lot of times people assume accept means I have to like it. You don't have to like it. You don't have to even want it. You can have a lot of grief around that. What it means is, so in acceptance and commitment therapy, there's a few metaphors that I really like. One of them is this idea that all of a sudden this monster shows up and it's living in your house, and no matter what you do, you try to push it out of your house, you try to call the police to get it out, you try to fight with it to get it out, and it's not going to leave. So you can either keep fighting with it, or you can let it live there and go about your daily business. So that's sort of the way I think about it. Is there are going to be times when you run into the monster in the hallway and you don't want it there and it's in your face. And there are times when you can go in the kitchen and drink a cup of tea and the monster's still in the bedroom, but you can enjoy that cup of tea, right? So it's sort of learning to live with it, but not let it take over your life. And the suffering comes with trying to get rid of it or wish it wasn't there, and maybe turning that energy and attention when you can to the things that really bring you meaning and joy. So that's my very quick answer, but it's a longer probably conversation.
It is. And I mean, you can't, I of course deal with Alzheimer's a lot, and this is also a question it's a little different because it's kind of a longer condition generally, but it's the same kind of dilemma. So Well, thank you so much. And now off to our mindfulness. For some reason, I can't pin people today. Did you guys assign me am I a co-host?
I thought I did. Where is Catherine?
I'm here.
Okay, all right.
Yeah, I found, okay, I found Catherine, but are you pinning? Oh, I think I did that. All right, fine. All right, well, now we have a blessing of our favorite mindfulness teacher who is with Mara Benner. And Catherine, any updates first before we let you in? What's new with you guys over there in the greater Alexandria?
I mean, we're still, teaching different classes, mind, body, spirit classes, Reiki classes. We are still doing things via Zoom. There have been some requests for in-person sessions, but predominantly everything's still through Zoom. So I would say just keep an eye out for the fall classes. I know Mara teaches a really great connecting with your ancestors class right around Halloween time. If anyone hasn't experienced that, I highly recommend it. I thought it was really cool. But yeah, I think
is your next Reiki 1 and 2?
I'm actually teaching a Reiki 1 right now. I owe Mara the fall class schedule. So there should be some stuff coming up in September, October, and November for everyone.
All right, and we'll make sure that we get Catherine's email and your clinic's info. So of course, we'll also put that in the chat. And with that, the floor is all yours, dear.
Okay, thank you. Hello, everyone. It's so good to be back with you. I hope everyone's been having a nice summer. I know it's been very, very hot. So hopefully everyone's been able to stay in the shade and in the coolness. We're going to do a couple of exercises today. I did want us to start just with a little bit of movement, gentle stretching before we settle in. So I invite you here. I'm not going to dictate. I'm going to say whichever one feels best for you. If you want to start by taking some gentle stretches. I see Dr. Kogan already stretching out his arms. Perhaps if you want to start with your hands, your fingers, just kind of rolling them, stretching them, just checking in and listening to your body. There's another really great practice. Oftentimes can be really helpful for those with trauma, but I find it to be beneficial for everyone. If you want to also just do some gentle shaking, so maybe shaking out your hands, your arms, maybe your feet and legs, feel free to stand up if you need to, maybe just getting out a little bit of either excess or restless energy. Maybe imagine you're shaking out or stretching out your day, your week, any emails, meetings, conversations that you just kind of want to place aside as we step into our container together here. Whenever you're ready and have returned to your seat, whether it be seated, reclined, or laying down, I invite you to find a comfortable position for your body. I invite you to close your eyes, hold a soft gaze forward, or keep your eyes open, whichever feels best and most comfortable for you. Perhaps it feels good to rest your hands in your lap, either palms face up for a more open, receptive position, or palms face down if you feel you need a little grounding, extra support today. Maybe even placing your hands over your belly, one hand over your heart, one hand over your belly might feel good as well. Feeling your feet planted on the floor beneath you, your sits bones supported by the chair, cushion, surface beneath you. And as you're ready, I invite you to take a deep breath in through the nose. Exhale, sigh it out through your mouth. Imagine releasing anything you need to let go. We'll do this 2 more times. Deep breath in through the nose. Sighing it out. And 1 more breath in through the nose. Deep exhalation. Allowing your breath to return to a normal, natural, comfortable pace for you. Just noticing what that feels like, the transition from 3 deep breaths to breathing as feels comfortable and unforced. Observing your breath at this time. Observing your breath as it flows in, breathing in through your nose, filling up your upper chest, lungs, and belly. And breathing out from belly, lungs, upper chest. And as you're noticing your breath flowing through you, I invite you to direct your attention to the breath in your belly. Notice what that feels like. The breath moving in and out from your belly. Now feel the breath in your chest. Feel breath in your nostrils. And feeling that breath once more as it flows through you. Perhaps easily, rhythmically, gently, through your entire body. Notice breath as it streams through you. Notice breath as it flows in to your heart and body center. And as you exhale, notice breath flowing outward to legs, arms, head. Inhale, breath flowing into your core. Exhale, breath flowing, radiating out. We'll continue this for 1 minute. Noticing, following that breath, as it flows into center. Exhale, radiating out throughout your body. Inhale, bringing that oxygen into heart and body center. Exhale, breath flows outward to arms, hands, legs, feet, to the periphery. Allowing yourself to continue to breathe in this manner. I'm going to invite you to just tap in and become aware if there is a place on your body where you feel any tension, stress, or maybe could use a little TLC. Just identifying it in your mind, maybe doing a very gentle body scan, just noticing where you may be holding tension, holding on to something. And if it feels comfortable for you as you continue to breathe, I invite you to just gently rub your palms together, building up a little bit of heat, warmth, or friction between your hands. And placing your hands on that area of your body. Your hands are an energetic extension of your heart. Imagine that you are bringing that love from within, sending it to this place in your body that perhaps needs just a little more at this time. We'll hold this here for 2.5 minutes. I'm starting my timer now. You can also use your breath with this practice, perhaps imagining breathing in maybe a little more love, relaxation, relief. And as you exhale, directing it to this area of your body. Breathing in, breathing out. Continuing to breathe, we have about 45 more seconds where we are. Let's take 5 more deep rounds of breath with our hands where they are. Savoring these final moments. Your hands in this position. Let's take one more deep breath in through the nose. Exhale, sigh it out through the mouth. Just releasing your palms to your lap, allowing them to be relaxed. And taking this moment of pause here. Checking in with your body. Noticing how it feels. And as you're ready, I invite you to once again begin to make some small gentle movements in your fingers, your toes, perhaps your wrists, your ankles, anywhere in your body that needs it. Whenever you are ready, I invite you to open your eyes as we come back together once again. I'm seeing your comments. Thank you, Jennifer. I understand you. Sometimes we might need to spend a little bit more time on a few extra areas of our body. I saw this question come in from Irene. So again, you said you don't need a response, but it might also just be something to consider. How does one learn just how much to ask from one's body? How does one learn how to be kind to your body? I think this is a really beautiful question. I'll just say, I know you said you don't need a response, but I have found that just as with any relationship that you have, right, with a friend, a family member, the more you remain in conversation with it, right, the closer you become, typically. And I think sometimes it can be the same from our body, right? Perhaps whether we say kind words to it, say loving things, showing appreciation. I'll just share, I struggled a lot with my body growing up. I had just a lot of injuries and I was always sick. So my body and I felt like we were constantly fighting, and it took a really long time for me to learn to appreciate, right? Even though I may not be able to do everything that I want to do, there's still so many things I can do. And I noticed that when I did that, there was a big shift. But even asking from one's body, sometimes we can ask, like, do I have the energy for this today? So just to build that awareness and being in tune, more in tune with ourselves. And I personally feel, and in my experience, and just in witnessing it in others, when we do ask, when we do remain in conversation, I think that we're able to get the answers, the knowledge, the knowing that we need. So hopefully that helps.
Well, thank you, Catherine, so much. I think it's okay if we end a little bit earlier, unless people have some other last moment burning questions. Janet, what do we have next week? Who is going to bless us with their...
Let me try and get that information. I had to do a little rebooting on my end.
And while Catherine is regular, and of course, we're hopefully going to have her back in a few months, we were chatting back and forth while here Catherine was teaching us that we really want to have Meghan back.
Yes, we do.
So I hope that she'll agree to visit us back. I really personally enjoyed the presentation tremendously and find it very in line with some of the way I think about certain things. And so thank you so much for your presentation. Also dovetails Catherine's practice really well, I think. no, that's Janet's wisdom of putting people together. I have not.
I would love to take credit for this one, but this is more Victoria
Okay.
Karacheva.
Well, good.
So yeah, I am excited about rescheduling, and hopefully she'll want to come back. In answer to your earlier question, it's going to be a CIM alum. Julie went.
Excellent. We haven't had Julie in a while, more than a year.
A long
Well, I'm
time.
excited.
And we'll have a new mind-body person, Moesha Mittal.
Great. Always good to see new faces. So everybody enjoy. It's gorgeous outside. If you're still indoors, reconsider being indoors. And it's like Megan said, if you're stuck on being scared of COVID and stuck indoors, unstuck yourself at least for the moment of being outside, because I think that I told you many times, risk outside of getting it a lot lower than inside. So do enjoy marvelous late summer. It's also not that hot, which is a blessing. So
get out, take your shoes off, walk in the grass.
Yeah, maybe at some point we'll talk about it. I don't think we've done any earthing conversation. Maybe we should do that.
You
That's
find
a
me
great
somebody and I'll set it up.
Yeah, let me think about that.
Okay.
There's a lot of earthing people that are a little overboard. So we have to get this right. Well, we're
Stop right there. Just stop right there.
Stop right
Okay, everybody,
Fine.
have a beautiful weekend. I'm going to end the video.
Bye, everyone.
Bye, everybody.